You also want to create a Department of Community Safety, and it would have a budget of roughly $1 billion, consist of mental health teams that respond to 911 calls, and have outreach teams at 100 subway stations. So first, which of these 911 calls would these mental health teams respond to?
The ones that are clearly New Yorkers calling in need of an intervention in a mental health crisis. I'll give you one example. I sat with the family of Win Rosario, a young New Yorker who was in the throes of a mental health crisis, called 911 himself to ask for assistance. 2 police officers were sent who had been trained in mental health response, and they killed him within 3 minutes. That is something that does not serve anyone in that situation. He is someone his family is still grieving, and it doesn't leave our city safer. And what we've seen is that across the country, there have been these very approaches that have been successful, whether we're talking about in Eugene or Olympia or Denver. This approach that we're speaking about is evidence-backed, and that's what New Yorkers deserve. They deserve outcomes. They deserve to actually have the safety they've been promised, but they haven't been delivered. And at the core of this is when we ask New Yorkers, where do you feel least safe? They often say the subway system. And that's why we've said we're going to have teams of dedicated outreach workers at the 100 subway stations with the highest levels of homelessness and mental health crises to intervene and provide assistance in the moments when New Yorkers need it most.
You know, we know that many people going through mental health issues are not violent in any sort of way, but on rare occasions there are instances where there is maybe some violence. How do you ensure the safety of these mental health teams if they're in the subway and something does go wrong?
You know, they can always call the police. That is a part of this program, and we've seen that, for example, in one of the programs I was citing elsewhere in the country, about 80% of the calls are resolved without police assistance. And there is a small segment that requires it, and for that, it is possible. But ultimately, what we're doing right now is we're taking the police, who have a critical role to play in creating public safety, and we're tasking them with every single failure of the social safety net. And that's preventing them from doing their actual jobs, which is dealing with major categories of crime. And what I've heard from so many New Yorkers is a concern that the clearance rates of those crimes are so low, and part of it is because police officers don't even have time to focus on it anymore.
Would the $1 billion for this department come from the police budget?
No, not a dollar would come from the police budget.
Perfect.